Hello, my name is Adila. Today my team and I will present guidelines on coding and sequencing complications of neoplasms in ICD-10. Neoplasms are abnormal masses of tissue that form when cells grow and divide more than they should or do not die when they should. Neoplasms can be categorized into benign and malignant types. Benign neoplasms are non-invasive, slow-growing and generally not life-threatening, whereas malignant neoplasms, known as cancer, are invasive, fast-growing and capable of spreading to other parts of the body. When it comes to anemia associated with malignancies, the appropriate diagnosis sequence is essential. If the admission or encounter is for managing anemia related to the malignancy and the therapy is only for the anemia, the primary diagnosis should be the code for the malignancy, followed by the code for anemia. For example, anemia in neoplastic disease is coded as D63.0. Consider the case of Mr. Rahman, a 51-year-old male with hypertension and diabetes who presented with fatigue, shortness of breath and weight loss. Blood tests revealed anemia and imaging detected a mass in his left kidney, leading to diagnosis of renal cell carcinoma. After a radical nephrectomy, his anemia improved and he was monitored for cancer recurrence. The diagnosis codes for his case are C64.9 malignant neoplasm of unspecified kidney except renal pelvis and D63.0 for anemia in neoplastic disease. C64.9 is used to specify the diagnosis of renal cell carcinoma, which is a type of kidney cancer. In this case study, a mass was detected in Mr. Rahman's left kidney and the diagnosis of renal cell carcinoma was made. Since the specific subtype of renal cell carcinoma is in detail in this case, the unspecified code C64.9 is appropriate. D63.0 is used to specify anemia that occurs as a direct result of the neoplastic disease. In Mr. Rahman's case, his anemia was associated with the presence of renal cell carcinoma. After the removal of the kidney mass, his anemia improved, which further supports the link between the anemia and the neoplastic disease.
When a patient is admitted for managing anemia caused by chemotherapy or immunotherapy and the only treatment given is for the anemia, the anemia code should be listed first, followed by the code for the cancer and the code for the adverse effect of the drug, which is T45.1x5. If the anemia is due to radiotherapy, the anemia code is also listed first, followed by the code for the cancer and Y84.2, which indicates the anemia is a result of the radiotherapy. In the case study of Mrs. Jamila, a 60-year-old female with advanced lung cancer who developed anemia due to her treatments, the primary code D63.0 for anemia associated with cancer, which is the main conditions being treated, is sequenced first according to the guideline in ICD-10-CM, followed by the secondary code C34.90 for underlying conditions of advanced lung cancer. Additional codes T45.1x5A for adverse effects of chemotherapy and immunotherapy, and code from category Y84.2 for adverse effects of radiation therapy were added because the adverse effect of radiation therapy on her hemoglobin levels decreasing.
The third guideline for coding and sequencing of complication is management of dehydration due to the malignancy. When the admission or encounter is for management of dehydration due to the malignancy and only the dehydration is being treated, the dehydration is sequenced first, followed by the codes for the malignancy. However, the code only can be assigned if the patient treated by intravenous rehydration, since if there is no IV given, it could lead to another condition in which another code should be assigned to the patient. This is an example of the case study related to the guideline. A 58-year-old woman with breast cancer admitted with severe dehydration due to vomiting and decreased food intake after chemotherapy. She had tachycardia, hypotension, and dry mucous membranes. Antiemetic medication, electrolyte supplements, and intravenous normal saline were the forms of initial treatment. After a day, her condition improved and she was sent home with an oral rehydration regimen and a follow-up appointment arranged. Therefore, according to the guideline, code E86.0 dehydration is assigned as the principal diagnosis, followed by the code C50.91 malignant neoplasm of breast of unspecified site female.
The last guidelines is treatment of a complication resulting from the surgical procedure. When the admission or encounter is for the treatment or complications resulting from the surgical procedure, then set the complication as the primary or first listed diagnosis if treatment is aimed to resolving by the complication. This is the example for the study case. A patient undergoes a mastectomy, surgical removal of the breast due to the breast cancer. A week after the surgery, the patient is readmitted to the hospital with a sign of an infection at the surgical site, including redness, swelling, and fever. Therefore, the primary diagnosis for the patient's readmission is to treat these complications: T81.49 infection following a procedure at the surgical site, and the secondary is C50.911 malignant neoplasm of unspecified site of right female breast.
In conclusion, accurate and systematic coding and sequencing of complications according to ICD-10-CM guidelines are crucial for ensuring precise documentation and effective healthcare management. This approach not only enhances patient care by providing comprehensive medical records but also facilitates appropriate resource allocation and statistical analysis, ultimately contributing to improved healthcare outcomes and patient safety.